Hey, hello, fellow YouTube hair transplant people. I'm doing a very special video today. First, I'd like to say it's been 10 months post-op. This is my hair. Um, well, there you go. 4th of July is around the corner, so that's also very special to us Americans. And also, I know this is looking very different to you guys because, you used to see me on the cell phone, and I know my cell phone front camera isn't the greatest, and I've been saying I'm going to be using the iPhone. And today I was sitting in my room about to do a video, and again, I was going to do the mistake of using my old phone when I decided maybe I should use the iPhone, and then I said if I do it on the iPhone, I can't upload it to YouTube, long story, but I'll have to put on a computer, and then I figure if I'm going to go on a computer, I might as well finally try out my first live broadcast on YouTube. So yes, if you're coming to my channel right now, this is live actually. So right now I have 0 viewers, so I'm still talking to myself like usual. I know this can be played back also, so I know also it wasn't announced. Next time I'll announce it. In fact, I'm going to announce it right now. My next broadcast will be live as well. And the purpose of this now, I mean, I think this is pretty cool because, you guys can actually talk to me live. You guys can actually log in with your webcams. Other people can see you, and I think we can actually have a pretty good forum going here. So any questions you have, um, I can answer live, and other people can listen to it. So I definitely encourage all of you to join in, and I'm going to even talk to my doctor, Dr. Benhem, Sean Benhem from in Santa Monica, California, dermatology and hair restoration clinic. I know I just butchered that, but anyways, here's my hair. While I talk some more about, um, this is 10 months post-op. I got September 1st, 2013. And the more I talk about this live broadcast, I'm going to talk to my doctor, like I was saying, and I will see if he wants to join us. Maybe he might find it pretty cool. Um, I'm just, like I said, this is my first live broadcast. I didn't really announce it, and let me know what you guys think about it, and let me know, how I should kind of officially announce it. I'm guessing the next time I'm going to do a live broadcast, a week before I do it, I'll announce it on this video in the comments. I'll say I'm going to do a live broadcast this date at this time, and I think that's the best way to kind of announce it. So if anyone wants to tune in, you guys can, and join it even. You guys can be on webcam if you don't mind yourself being seen, and if you do, maybe you can like pull a home improvement, neighbor of Tim Allen, something like that. I'm pretty sure actually Google, I think they have these cool effects even that block your face. Like I said, this is the first time. Um, is that drawing on my face right there? I don't know. Oh yeah, look at that. So, um, yeah, you could definitely do that. You could block out your face like this, I think, right there. My face blocked out right now. How does that look? Is it blocked out? Yeah. So, you know, has some pretty cool features. But anyways, getting back to my hair, like I said, this was a special broadcast. Also being at 10 months. I mean, just look at the thickness on this hair now. This is a little trickier than a cell phone. Let me see if I can unblock my face. What is all this? What's this? Okay, I think I unblocked it. All right. Anyways, so yeah, I mean, I know I must look a lot different in the computer screen, but let's just look at my hair right now. I actually came prepared. I brought a comb, and I think that's always pretty cool to just comb through it. Just look at that. I mean, at this point, if you're debating whether to get a hair transplant or not, subscribe to my channel. Just look at my journey so far, 10 months into it. I've documented every step of the way. I even said whenever I get a haircut, I document it before I get the haircut and after. And I know recently I haven't put any of those videos up because guess what? I haven't really had a reason to get a haircut. My side hair is growing out now, but it's looking still smaller than the top of my head. So I mean, just look at that. You know, So where I got it done was this is middle portion right here. You can see it's the hairline's still fairly far back, and a lot of people are telling me it's not that bad looking because compared to me being bald, they're like, okay, well, this is a lot better hairline. I still feel like my hairline should be this low. A lot of people are like that's fairly low, it's unnatural, but if I wanted to stay natural, I would have stayed bald, as I've said before. Um, I am planning to see the doctor soon. I just really haven't had time to make an appointment and go see him since I've come back from India, and I actually did get him something from India. So if you are watching this, Dr. Benham, I do have something for you from India, and I do want to go see him, and I'll definitely document it when I do. And I'm considering setting up a second hair transplant because I'm thinking of doing the strip surgery. So if you let me know what you guys think about the strip surgery. I did FUE the first time, 2,300 grafts. It looks great. The reason I want to do strip surgery is because it's cheaper, it's quicker, and by quicker I mean this took 2 days to do 2,300 grafts, 2 full days. I'm talking about from like 7 a.m. to like 6 p.m. I was there. Didn't get home till almost 8 p.m. That's an entire day, pretty much. 12 hours, Not saying I stole, but he does one patient at a time, and he does it himself. He's Dr. Benham. He pulled out each follicle himself, about 1,100 to 1,200 a day, and replanted it. He did have technicians plug them in, but he put the holes. He placed the holes. Um, if I do strip, he can do probably 2,000 in one session in like 5 to 6 hours in one day, and it's going to be like half the cost. Split that in a 2-year payment plan with no interest. I mean, it's fairly cheap. Anybody can really afford that if you even make 30, 40K a year, depending on your expenses. What else was I going to say? So, anyways, what I'm thinking is if I do 2 strip surgeries, 2,000 in the front ear and 2,000 on the crown, because I think that's really where I'm still balding at. You can see that. I can't see it myself. Um, I hope that wasn't too close. But, you know, then I'll pretty much be done, and then I won't really need to get another surgery um, probably ever again. I mean, if this is what 2,300 covered, I can only imagine another 4,000. I'll have pretty much a full head of hair. That's 6,000 grafts total, if my math is correct. Let's take a look at that. Just look at my previous videos. If you see that and then you see this, trust me, if you're concerned about being bald or you didn't want to bald, if this video hasn't convinced you to go get it, then I really don't know what to tell you. Um, Feel free to ask me any questions, leave any comments, questions. I know a lot of you have. I feel like my next video, I'm going to give some shout outs to some of you people who have left comments. I'm not doing it right now because, honestly, I remember a few of your names. I'll just do it, next time. uh, but yeah, and then this one guy did contact me named Andrew. I don't know if he's watching this video, but I think he has an appointment with Dr. Benham, the doctor I went in Santa Monica, sometime in July, maybe next week, I think, on Friday. He told me to actually go out and meet him, so maybe I will. Maybe I'll film it. I'll film it, and I don't know if he's okay with being in the video, but maybe I shouldn't have even said his name before asking him. But you know, and it's not like I said his last name, so and there's hundreds of Andrews, I guess. Uh, anyways, yeah, there you go. Look at me. I can have a hairstyle now. So, this is pretty successful. I'm pretty satisfied. So, let me know also what you guys think about the live broadcast. If anybody wants to join in, maybe they can give me a preferred day and time that they prefer or something. I'm in California, in Los Angeles. So right now I'm recording this at 10:52 p.m. Um, Pacific Standard Time. I know me recording at what time right now. So maybe let me know a time where it can work with everybody. I am usually in my office Wednesday, Thursday, Fridays from 10 a.m. to 6 p.m. So maybe those times, if we can avoid, let's try to avoid those, and let's try to pick a time maybe on a weekend or something. We can do a live hangout, kind of. That'll be pretty fun, I think. Let me know if you guys want me to go back to the cell phone. I probably will if no one wants to do these live hangouts. I'll try out the iPhone, and I'll even try out the back camera on my cell phone. Yeah, you guys get to finally see the recording device that I usually use. All right, I hope I gave you guys a good update. You know, you guys know I got FUE, so probably have some white dots which you can't see. So uh, no pain, no redness, no nothing. Hair. Uh, yeah, actually, one of my buddies called me today, and he did have a he saw my hair just this weekend. I'll let that pass, and he was impressed. He was like, "Holy crap, you got hair!" You know. He's like, "It's a real deal." He's like, "It looks perfect." Um, and he's also a little balding in the crown, and I told him, "Yeah, I know you guys are lucky. I went through this. I know I'm not the first one to go through it. I know there's millions of people who have done it, maybe billions even. I don't know." um, but at least he knows someone personal he could ask questions to, and I hope that's what I'm like to you guys as well. And he asked me one thing. He was fearful about the pain, and I told him it's less pain than going to a dentist, and that's somewhat true. I know in my previous videos I said I'm uncomfortable with getting any injections and stuff as far because I don't know, what kind of side effects those injections are gonna have. But besides that, it was pretty painless. And you can watch my previous videos. I filmed it during the operation, and I filmed even right after and right before. So, and the day after and the night after. So you can actually see how I'm talking to the camera, and I describe my pain levels as I'm feeling it. Happy 4th of July, and let me know about the live broadcast if anyone wants to keep seeing those.